Now let's talk about the most effective and least expensive mouthwash. And when you use these terms, most effective and least expensive, to the patient, their ears really perk up. The solution that I'm going to talk about, I was introduced to this by Dr. Jorgen Slotz when we were at a conference in Mexico City in the early 1990s. And basically what this is, an 0.5% solution of sodium hypochlorite, which is household bleach as you see, and using that as an oral rinse. Anecdotally, he used 1 teaspoon per 8 ounces of water and simply rinsed that in the mouth. And he's written several articles on the efficacy of this, one of which is listed below. But what you want to use is plain unscented sodium hypochlorite. Now there are a couple of modifications on this, which again, in my opinion, are anecdotal. He dealt only with diseased mouths, and the solution that he mixed up was 1 teaspoon to 8 ounces of water. Now in my mouth, which is healthy, I use 1 teaspoon to 32 ounces of water, and not having any pockets and not having to get it down below the gingiva, I find that this works very well, especially using this before scraping your tongue to clean the debris off the backside of your tongue. That, I say, is used for a healthy mouth. If you have residual pockets or periodontal defects, then I think you should increase this to 2 teaspoons to 32 ounces. And if you're going to use a water pick on that, I think using 8 teaspoons to a gallon of water makes more practical sense, which we will talk about in just a minute. And this is used for treating periodontal defects or periodontal pockets. Now I've used a term that probably you're not familiar with, and that's periodontal defect. And how does that differ from a periodontal pocket? Please go to this video, which will outline the difference between the two as we approach the concept of curing periodontal disease. Let's talk about practical considerations. First of all, when using a water jet to treat pockets or residual periodontal defects, mix 8 teaspoons to a gallon of water. We'll talk about why that is necessary. Place about a half a quart in the reservoir on the water jet, and be very careful because in using this, you're going to get some splatter which will actually bleach clothes. And we're talking about practical considerations, and the reason we're doing this is if I mix 1 ounce to a quart of water as an oral rinse, this lasts a fairly long time. But if you only mix up a quart of this and you put it in the reservoir, you're going to have to mix it up every 2 or 3 days. But if you mix it in a gallon in the same proportions that we've talked about, this will last much longer. And I think because this does break down over a period of time, as you will see later, I think you ought to mix up a new solution either in a quart or in a gallon approximately every 2 weeks. So the simple way of doing this, if you have the healthy mouth, is to be very careful on exactly how much you measure. And here we see using measuring spoons to accurately determine the amount of sodium hypochlorite to use in this oral rinse. And what we're seeing down here is on the top a teaspoon and on the bottom a tablespoon. So be very careful in mixing this up to mix it up the proper proportions, because more is not better. 1 teaspoon of unscented sodium hypochlorite to a quart of water here, as we see in this diagrammatic presentation. Before using the solution, please watch the importance of cleaning your tongue, a short video demonstrating the importance of cleaning your tongue where sulfur-forming bacteria are left on the posterior part of the tongue unless it is scraped off with a tongue scraper. How do you use the solution? Very simply, use 1 or 2 ounces of the solution and swish between your teeth after brushing and interdental cleansing. Notice we want to do a good job of removing as many bacteria as we normally do in brushing, flossing, or using interdental brushes. Second, before emptying out the solution, gargle to kill the bacteria and viral pathogens on the posterior third of the tongue. Again, see the video, The Importance of Cleaning Your Tongue. Finally, this gargling kills pathogens associated with postnasal drip. Before using the tongue sweeper, we have already rinsed the mouth with the oral rinse, and you want to empty out most of it, but what's left in the mouth you want to use to scrape the posterior third of the tongue. Finally, you want to rinse vigorously with plain water and spit that out. Under no circumstances should you think about swallowing the solution, and be sure and rinse vigorously with plain water once you're through. The acquired pellicle. This is a thin protein-containing film derived from salivary glycoproteins, and it begins to reform 30 seconds after brushing. So let's go back to our thinking 25 years ago when the water jet, water pick type apparatus became available. We knew that it would flush out some bacteria, but we were concerned because this pellicle persisted. So in now redefining and thinking about what is bacterial plaque, that means this, when the bacteria attach to this pellicle, this becomes bacterial plaque. Here's an older article, goes back to 1986, on the dental water jet. Moderate hydraulic forces produced by dental water jets can significantly remove the biofilm. Biofilm is synonymous with the bacterial plaque that we talked about earlier. Here we see a diagrammatic view of the dental water jet pulsing in between the teeth, and water picks are available via ordered on Amazon somewhere between $30 and $60. By using a water irrigator, the solution is forced deeper subgingially. By mixing a gallon, you only have to mix a solution about once every 2 weeks. And whether you're using a gallon or a quart, I think whatever is left over at the end of 2 weeks should be discarded. Does a solution degrade and lose potency over time? And we've already said, yes, it does. So therefore, empty the solution, as we said earlier, about every 2 weeks. But if you're going to use this solution, we need to have a disclaimer. This information is being provided for educational purposes only, and the solution should only be used at your own risk. Number 2, this is not a prescription. The solution, as I said earlier, should only be used at your own risk. Third, under no circumstances should the solution be swallowed. Children should not use this solution because they may inadvertently swallow some of the solution. And certainly, expectant mothers or women considering becoming pregnant should not use the solution because we have no idea what the impact may be on the developing fetus. We need to know what the side effects can be in using sodium hypochlorite. And drinking bleach can cause effects that range from mild to serious, depending on the amount ingested. Medline Plus states that consuming diluted bleach or sodium hypochlorite may lead to a mild stomach irritation. Increasingly large amounts can lead to a gagging sensation, pain in the mouth or the throat, burns in the esophagus, chest pains, low blood pressure, slowed heart rate, delirium, coma, shock, vomiting, and in some cases, some severe abdominal problems. However, given the weakness of the solution that we're discussing, if the protocol is followed, only minimal amounts of sodium hypochlorite could possibly be swallowed. And this is from, as I said earlier, 2017, the Medline Plus. Historical thoughts in future directions. When I was 12 years old in the early 1950s, the Virginia Health Department came to our school and applied topical fluoride. There was no fluoride in the water at that time. Does using this oral rinse have the potential for the same impact on treating periodontal disease that fluoride has on reducing the incidence of dental caries? Thank you very much.